Thank you. Hi, my name's Kate Martin. I run Common Room, which is a small consultancy led by people with lived experience of long-term physical or mental health difficulties, and we have a whole team of young people who work with us to co-design, co-develop all of our projects. And we developed this project in partnership with Great Ormond Street. I've noticed they've been missed off the title. I'll apologise profusely. I'd just like to say, though, about the improving the phone lines. Well done. I've used loads of different hospitals, lots of different healthcare services since I was very tiny, and I swear I've met some incredible staff, but those phone systems, you need a degree in and of yourself to try and figure out how to get hold of who and when. So well done. It's brilliant to hear about your project. So Me First is a project we've co-developed with children, young people, healthcare staff to improve communication between with children and young people. Most importantly, about involving them in decisions, choices and decisions about their healthcare, making sure their healthcare is what they want, what they feel is right for them. So we've worked in partnership with a really great team of young people to co-design all these resources, young people who've really given their all to this project to make sure that this is really grounded in children and young people's lived experience. We've engaged with loads of healthcare staff from all different healthcare services, paediatric healthcare staff who are really experienced about engaging with children and young people, non-paediatric healthcare staff who are seeing children and young people all the time, really want to be able to listen to children better, but perhaps struggle in terms of thinking how they might do that. So again, developed with lots of different healthcare staff, and we've got a communication model to really give a framework to how to have better conversations with children and young people, a one-day masterclass, and a website with short films, resources, all that. I'll talk you through some of those in a minute. I think the main thing to say about all of this is we want to ground it in what works. So often people are told what to do. Improve communication, improve patient experience, involve people in decisions. Well, that's great. I don't think any of us would argue with that. But how do I do it? When I walk into my consultation room tomorrow, when I open the curtains on the cubicle, what is it that I say or do differently? And so that's why it was really grounded in people's experience, a healthcare practitioner experience of what works. What do I say differently? What do I do? So it's not about basic communication skills. We're not sort of teaching people that it's teaching people to suck eggs and saying it's about good body language and eye contact. We're taking that to give them. People who come on the courses and use our resources are really skilled, experienced healthcare professionals. We're trying to take it to that next level and think about, okay, some of those trickier conversations involving young people in treatment decisions. How do we do that? And we really focus on those small practical changes we know that can make a huge difference to patient experience. All the young people I speak to, I can think about all the times I've accessed healthcare. It's those little things that stand out, those moments where someone was compassionate, where someone took that extra moment to listen, to really understand what was important to me. I think they're the moments that people always remember, but sometimes the first things that we can forget. So why is this so important for young people? I think this quote says it all, really. Lots of young people told us similar things, such as I should be the one involved in decisions about my health because I'm the one feeling the pain. No one else knows what I'm feeling. So, you know, we can bring an awful lot of expertise. Parents know an awful lot, of course they do. They're great advocates for their children, for their child, but it's children who know what's really feels right for them. And we know that lots of young people say they weren't involved, don't feel involved in choices and decisions about their healthcare. That's something we really need to tackle. And that's because often young people say that communication is often between the healthcare professionals and their parents and carers. They say that what healthcare professionals are really good at is social talk, making them feel welcome, making them feel comfortable, house school, house things. But the minute we turn to treatment talk or decisions, very quickly the conversation often shifts back to being between the adults in the room. And young people are less involved in making choices and decisions about their healthcare. I know that makes young people feel very anxious, very out of control. They don't understand what's happening, what's going on, perhaps don't often feel that what's happening is right for them. Can make young people feel resistant, like all of us. If we don't know what's happening or we're not sure about it, we can understandably kind of be quite resistant to that. I think that's understandable. And lots of young people said things like, it feels like my parents are the one with the condition, not me. It feels like I'm sat there being spoken about. And I know people are doing the best for me, but actually I really want to be engaged in those decisions. I'm the one that knows what's best for me and my life. And we also know that where people aren't engaged in decisions, don't feel that things are right for them, we know that can cause conflict. And we know that some of the most common causes of conflict in healthcare, paediatric healthcare, are communication breakdown, disagreements about treatment, and unrealistic expectations. So really, this isn't just a nice thing to do. We know this has a significant impact on the experiences of staff who are having to deal with conflict, as well as for children, young people and families. So we brought loads of people together to develop, we've got a website with loads of resources on there. The main thing for us about this website is that we're trying to kind of collate all the brilliant examples from people across the country about things they're doing, approaches they're using to communicating with children and young people. There's some nice, shiny, professionally produced resources on there. I think the best ones, though, are sort of practitioner-produced resources, so drawings that people have done with children to help them explain things, you know, guides written by children with their healthcare staff about how they want to be helped and supported, etc. So please, if you know of anything, please do share it with us on there. We've got loads of top tips, as I said, so real practical examples from healthcare practitioners and from young people about example sentences, practical things that people say or do. Covering all sorts of different issues, some examples here. So, for example, how do you get to see a child on there? If you want to be able to have a conversation with a child, how do you ask a parent to leave the room without that seeming really awkward and really difficult or making the parent feel anxious? So how do you, lots of ideas there from various people. To trigger in people, actually, what could I try? Maybe that doesn't quite work for me, but if I adapted it, maybe I could do that. Again, if you've got any examples, please do share them with us. We're really keen to make sure we grow this as much as we can. There we go, that's examples of some of the resources on our resource hub, and I say we're hoping to grow that as much as we can. And then we developed a communication model to give, I guess, a practical framework to say to people, when you're thinking about having conversations with children and young people, involving them in decisions about their healthcare, what are some of the key steps to a good conversation? This was based on a review of the literature around shared decision-making, person-centred communication. And unsurprisingly, I think at the moment most of that was directed towards adults, conversation between two adults, and we had to work with children, young people, others to think about how do we address some of the particular issues that children and young people face. So I'll whiz through some of these quickly. So right at the start of the conversation, how does that child or young person know that they're part of that conversation? Most young people are quite used to being spoken about, aren't used to their opinions being sought about their healthcare. So how do we really make sure that we're putting them at the centre of the conversation from the start? So show me that you want to listen to me. I'm sure you've all heard of the Hello, My Name Is campaign, but making sure we're introducing ourselves to the young person first. And those really simple things can really make sure that young person knows this is about me. I'm the centre of this conversation. If my parents with me, let me know you want to hear from me first and then my parents, so we all know will be heard. And that just helps parents sit back. I think often parents, parents are trying to do the best thing for children and young people, make sure they get the best out of that often very short amount of time. But how do we make sure we're balancing the children's views with their parents? There we go. How do we get a shared understanding? So making sure... I'm flicking through ahead of time now. Okay, so how do we get a shared understanding of why we're here? So a shared understanding of a young person's problems, goals, to make sure everyone's on the same page. Making sure we're asking young people about all of their concerns, not just their condition or their symptoms. What effect is this having on their life? How's it affecting their friendships, their school? How we get a real understanding of what the best help and support is that we can provide. What are my choices? How do we help young people understand the choices available to them, the pros and cons? This is the thing that young people say is the most important to them about their healthcare. How do I understand what's right for me, the pros and cons? How can I weigh up what feels best for me? And thinking about that there are always choices, not just choices about what can happen. So some of those bigger decisions, it's not just about the bigger decisions, it's about how things can happen as well. How do I want the test to happen? Do I want to sit next to mum or don't I? Do I want you to tell me, count down to the needle going in, or I just want you to do it? So really helping children feel in control. How do you know what's important to me? So making sure we really understand young people's views, their preferences, what they think would work best for them, their life, any worries, concerns they may have. Checking in that we all agree what's going to happen next and how it's going to happen to make sure that children feel in control of that, and making sure that young people realise that this isn't always set in stone, that we can come back and we can review. It takes the pressure off some of the decisions sometimes, that we know that we'll just see how this goes, then we'll come back and check in. And and what will happen next. So how do we summarise the conversation, make sure that we've answered any questions, made sure that when the young person leaves the room, well, like any patients actually, we all go, yeah, I'll remember that. And then we walk out and go, what did they say again? So how do we help children and young people take notes or something? How will we help them remember that conversation? And most importantly, how do we help them know what the expectations are? So if we say, if we give a young person a prescription, do they know the signs and symptoms to look out for? Do they know that it might be normal to feel a bit sick after a while when you first start taking tablets? So how do we really make sure they understand what's going to happen next? So that's our model, really quick whistle-stop tour that we spend most of a day of training on. We've now trained, I think brilliantly, we've trained over 200 healthcare professionals now. Really excitingly for us, we've just had the the independent evaluation results back. We've done a pre and post survey, so survey 8 weeks post-training, and we're showing significant change across all domains that were measured around the skills and attitudes of healthcare staff. So the main thing for us with this is making a difference, and not just, you know, we can all get excited on a training day. Does that make a difference to our practice? That's where we really know whether they're making a difference or not, and we're really excited to say that people are making changes to their practice, are changing conversations with children and young people as a result. So thank you very much. Right, 12 seconds.